what I'm going to be doing is giving you a quick introduction to what a sound sensitivity is, how we make the diagnosis, what treatment options there are, so what's available, what the evidence for the treatments are, and what we think would be best practice. And really what I'm aiming to get across is what hopefully we should be advising in general practice. As a bit of context, the dog on this slide is one of mine, sadly no longer with me, but that's Molly, and she had a really serious sound sensitivity when she came to us as a rescue, and she's the reason why I started in animal behaviour. So for some background, just the idea of how common these things are. In the PDSA report in 2018, 40% of owners felt their dog was afraid of fireworks, 24% felt that they were afraid of thunder and lightning, and a further 24% felt that they were afraid of loud noises in general. So you can see that that's a really significant proportion of dogs in the UK who are reacting badly to noises. I don't have figures for cats, but I suspect they may be similar. So how do these things develop? Well, we think there's probably some genetic susceptibility. We certainly see particular breeds that seem to be more predisposed to sound sensitivities. It may be that they've had insufficient habituation to noises early in life, so they've not been exposed to them early on and learnt that they're okay. And certainly there's some evidence for that in research that suggests that sound sensitivities are more common in dogs born at particular times of year when perhaps the difference is in exposure. Also, there may be some element of sensitization. So if they're repeatedly exposed to a sound event that they're not coping with well, then they can become sensitized and become more sensitive to that. And it also may be the result of a traumatic event, so something significant that's happened that's really frightened them. We need to think, though, that there is actually a normal response to a sudden loud noise. So, for example, if there's a firework goes off now outside while I'm doing this webinar, I'm probably going to jump and lose my place and stutter for a bit. But I would hope that I would quite quickly recover. And we should see the same response in our pets, really. Hopefully they would quickly recover, and that response may be adaptive. So then if there's a second loud noise, hopefully I would recover a bit quicker and learn that actually it's not significant to me at the moment. We need to remember, though, that our pets have more acute hearing than us over a wider acoustic range, and so they're going to respond to a different array of noises. Then we need to think about what is a phobia. So this is an irrational fear that's out of context to the actual level of threat. So some of these animals will respond to noises that actually are completely normal within everyday life and that other animals cope with completely. They can limit normal behaviour, so preventing them carrying out their normal behaviours, and they can persist for a long time after the threat has gone away. So you may have clients come in saying that actually the dog's been quite unsettled for a couple of days after fireworks. I wanted to talk really quickly about diagnosis. And we think it's obvious, don't we, that they react to sound, and that's what a sound sensitivity is. But that actually isn't always the primary reason that the animal presents to us. So they may come in as having been destructive in the house as they panic, or they may present as having shown aggression. If the animal was trying to hide and the owner tried to drag it out, for example, from under the table, the dog may have snapped and then been presented for aggression. We also need to consider that there are medical factors that may influence how the dog responds, and we need to think about those. So, for example, sensory changes to the way they perceive sound or even to their vision can change the way that they respond to noises, and they can also increase the animal's feeling of vulnerability and so make them more likely to react. There's also an element of how chronic pain will affect them. So chronic pain can reduce the animal's ability to use their coping strategies. We'll talk a lot later about hiding and how that can be a helpful coping strategy. But if the dog has always gone upstairs and got in a cupboard, and actually they can't do that anymore because they're too stiff to go up the stairs, that can have a really significant impact on how they cope. We also find that chronic pain induces a negative emotional state, which can lower their threshold for showing these behaviours. We should also consider cognitive decline. Often sound sensitivities present perhaps a little bit later than some of the other behavioural conditions that we deal with. And we need to think, is it partly that they're not able to remember that they coped with these noises before? Are they just generally coping less well with life than they were last year? And finally, we need to think about endocrine diseases. Anything that impacts on the way the animal deals with stress can affect how they react to a noise. The other thing to think about is that these conditions often present alongside other anxiety-related conditions. So it's not at all unusual to see a dog that has both separation anxiety and a sound sensitivity, or is a bit nervous about other dogs or people and sound sensitive. Okay. We also need to think about why sound sensitivities are important. And for me, they're important because they cause really significant distress, both to animals and their owners. They also can get worse. So dogs can learn to make predictive cues. So they learn things in the environment that might predict the noise that frightens them. And typically at this time of year, I see dogs who no longer will go out for a walk when it's dark because they've learned to predict that darkness means fireworks. We also see dogs who will get worried and anxious at the first sign of rain because that might predict thunder. These things can also generalize. So that means that they slowly begin to react to an increasing array of noises. And that was what happened with my dog. She came as a rescue with a reaction to thunder and to fireworks. And by the time I realized how significant our problem was, she reacted to a whole heap of household noises. You can also see further sensitization. So each year they're a little bit more worried by the noises than they were before because actually they haven't coped and they haven't learned that they can deal with it. So the important thing is, can sound sensitivities be treated? And yes, they can. But there are really two ways that we attack them. The first is with the emergency management of phobic events, which is what we're talking about tonight. So what we want to do is help the dog cope right now. But the long-term aim is to change the dog's emotional response or the cat's emotional response so that they're actually able to cope better and don't need the support in the short term. Okay, so we're going to focus now on the emergency management. And for me, there are really three key points. We need to do preparation, we need to do management during and around the event, and we need to think about medication. For preparation, we need to say to clients that in whatever time they have, they should make a plan. The absolute gold standard for these animals is actually not to expose them to the scary thing at all at a level where they can't cope with it. And if actually the client lives next door to a public field where there's going to be a big fireworks display, then it may be that the most sensible thing is for the animal to go and stay with a friend or family member for a few days in a safer place. We should also think about preparing a safe den and making sure that the animal is accustomed to this area and happy to use it. And I'm going to talk a bit more about that in a minute. We should get clients to check times of local displays and to speak to their neighbours to see whether they've got any fireworks planned so that they can make a good plan for what they're going to do and what the days are that are going to be problems. It's also sensible to suggest that clients get the animal's microchip details checked just to make sure that if something does go wrong and they lose them, that hopefully they'll be reunited. But above all else, we need people to make a plan, to know what they're going to do and make sure that all family members know so that if there's an unexpected sound event, they are ready to deal with it. So for management, I would suggest that we walk dogs before dusk. What we don't want is for them to suddenly need the toilet when the fireworks display is on. That's stressful for them and obviously potentially quite upsetting for the owner if they toilet indoors when they're stressed. Cats should be provided with a clean litter tray and make sure that they are safe indoors before it gets dark. We would suggest that you feed your pet in the mid to late afternoon in the hope that they're going to be a little bit more relaxed and sleepy by the time the fireworks start. Obviously close cat flaps, windows and doors and make it really obvious that they're closed. We don't want cats pushing on cat flaps and worrying about why they're not opening. Also think about, closing curtains, closing internal doors, trying to muffle the sound as much as you can. Make sure that the animal has access to their safe place. It's no good having a safe place set up in the kitchen if actually the animal's in a lounge and there's a door shut. Try blocking out the noise using TV, white noise or music. However, make sure that the animal's comfortable with that noise. So if your animal's always frightened by the TV, don't use the TV. And bring small pets inside if you can. If that's not possible, maybe take them into a garage or a shed or even cover the run or the hutch to try and muffle the sounds for them. So I said we'd come back to safe spaces. Hiding is a really important coping strategy for dogs and cats, and it's one that we really want to encourage them to use when there are these sound events. So the ideal safe place is actually a place that the animal has chosen for themselves. So some dogs will go and get in a cupboard because it's quite insulated. We see some trying to get under a bed or, to crawl under the table. All of those places, if they've chosen it and it's safe for them to do so and not enormously inconvenient for the owner, should be encouraged. But make it as good as you can. So this little dog has a crate in the place that he's chosen, and that's been covered with a blanket to make it even more sound insulated for him. prepare it in advance. So the sooner you can get this set up and ready so that the dog's used to using it, the better. Make it a really positive place, hide some treats in there, encourage them to go in, but don't shut them in there. This needs to be their choice and it needs to be available all the time. What we're doing is encouraging this hiding as a coping strategy. It's also nice if the animal has some element of control over the situation. So you could put some blankets in and then they can choose. Do they lie on top of them comfy, or do they dig down and bury themselves underneath to muffle the sound? I also wanted to talk about how the owner should respond in these situations, because there's been loads of conflicting advice given over time, and I think that's been really unhelpful. So I wanted to just tell you what I tell clients so that you can think whether that might be helpful for your clients. So the first thing I say is that actually if your pet hears the noise but they remain calm, then maybe do something nice with them, but not anything too emotionally arousing. So maybe some searching, scattering some treats, nice stuffed Kong, licky mat, those sorts of things. Cats who are calm could be offered attention if they like it. Not all cats do, but some do, or some nice food treats. If they're a little bit anxious, then continue to offer food, but up the value of it. So maybe some cooked meat, some chicken, a bit of fish, some cheese, pate, those are really nice things as long as it's not going to upset the tummy. Increase your efforts to reduce the impact of the noise. So can you move to a better insulated room? Could you cover the doors or windows? Can you adjust your background noise? And make sure your pet's aware of their den and encourage them to use it, but don't shut them in there. If your pet is really distressed, don't punish them. If we punish them when they're frightened, what they then have is they're frightened of the noise, but they're also frightened of our response, and that can make them more fearful. And finally, I think for many pets, contact with their owner has actually become a really important part of their coping mechanism for these fear-inducing events. And obviously, the long-term aim is to make sure that we're encouraging independent coping strategies, but we need to acknowledge that in the short-term emergency situation, these animals suffer significant distress, and therefore we should take any steps we could to reduce it. So if the owner knows that what the animal really wants is to be with them and to sit touching them or to be stroked, then they shouldn't overly encourage it, but they should do what the animal needs. So don't, if they're coping, they're okay on their own, don't call them over for a fuss. But actually, if what they need is to be with you, that is fine in that emergency situation, and tell them that we'll try and make it better for next year. But right now, we just need to do what we need to do to keep our animals safe. Okay, so finally, I want us to talk a bit about medication. So we need to think, animals that have previously shown a phobic or panic response to sounds should be receiving effective evidence-based medication. And what we should be looking for is something that provides an anti-anxiety effect, something that's going to minimize any further negative learning so that things aren't getting worse. And we need to think if the animal's panic response is to run away, or if they're becoming very agitated, we might need some level of sedation in order to keep them safe. Ideally, clients will approach their vet at least 2 weeks prior to the event so that we can discuss medication, but we know that in the real world that doesn't always happen. So what we would suggest in terms of sensitivities, if the animal's fears are quite mild, then it may be that actually just an anxiolytic medication is sufficient, because it might actually be helpful for the animal to remember that they heard those noises and that they coped and they were okay. And for this, we have the licensed option of dexmedetomidine, Sileo or Sileo, whichever way you'd like to pronounce it. It can be tricky to administer to some dogs, but actually can work really well for others. If you can't get the Sileo into them, then it might be that trazodone could be an option, although obviously unlicensed. If the animal has a really severe fear or phobia, then we do need the anti-anxiety and the amnesic effect. And really the drug that we would reach for would be a benzodiazepine in this situation. They need to be given at least 20 to 30 minutes prior to the event in order to show the full effect, and particularly to get the sedative effect. They are obviously unlicensed for this use. We think that there may be some retrograde amnesia, although we probably need more research on that. But there's probably still value to giving them, even if you come home and the dog is upset, you still give them up to 30 minutes after the event, and you may still get some effect in stopping the formation of new bad memories. You do really need to do a test dose with benzodiazepines, so that's why we suggest people come in early, because actually there is some individual variation in how they respond, and you do sometimes get the paradoxical excitement. So just make sure that you have checked that it suits the animal, that the dose that you're using seems to be effective for them, And it may be that you need to try a combination of things or something else. I'm not going to talk about all the medication options here, but we're happy to answer questions later. And there is a handout that we'll upload, which will hopefully give some more details. And then there's a whole heap of other options. So lots of other things that are now available to support animals with phobias about sounds, and particularly for the fireworks season. The first one is the pheromones. We know that there's research to suggest that these can be really beneficial alongside appropriate environmental management and medication as required. But I think the key thing there is not just to sell someone a diffuser, but actually to speak to them and say, you know, have you got the management in place? How bad was it last time? Is it just that you're being prepared, or do you think that your animal might need some more help? Think about the supplements and nutraceuticals on the market. The problem we have at the moment is that there are absolutely loads of these available, but a real lack of good placebo-controlled research. And it's entirely possible that they may be beneficial, but we just don't have the research to prove that. And therefore, we shouldn't be using them in preference to something that we know has a research basis. I wanted to talk quickly about CBD oil because it's so topical at the moment. It has been classified as veterinary medicine in the UK by the VMD. So really, we should be only prescribing it on veterinary prescription. And there is no licensed veterinary product at the moment. So anything that we use will be a human product. As yet, there is no research to support efficacy for this for sound sensitivities. There is a really recent article that's come out in September this year, looking at comparison between CBD supplement and using trazodone in that particular study, and they didn't find any beneficial effect, although there were some limitations, and we probably do still need more work. And then there's things like the thunder shirts and wraps. I think we just need to be aware with those of what the owner is actually seeing. So for some animals, it may be that it's genuinely calming, but I think for some animals, they do tend to freeze when they're putting these things. And I think any of you who are in practice who've put a cat in a pet shirt will probably have seen that happen when they suddenly realise they can't move because they've got the pet shirt on. And I think we just need to make sure that's not what's happening. And then ear defenders and earplugs can be really useful for some animals. They do need careful introduction for dogs, and they're certainly not suitable for all animals. But with the right introduction and the right animal, they can be a useful option. I just wanted us to consider what our responsibility is as veterinary professionals. So fundamentally, it's the welfare of our patients. And to do that, we need evidence-based medicine. We need to follow the prescribing cascade. We need to recognise the limitations of our knowledge and refer to an appropriate person if possible. We also probably need to think about our responsibility to the client and making sure that we're getting them value for their money. Some of these supplements and nutraceuticals are actually really expensive. And if it's choice between using an evidence-based medication and a nutraceutical in an animal that has shown genuine distress, then clearly the best use of their money is to use something that we have the best evidence for efficacy with.